So we could also write notes to each other, although the whole thing will be filmed.
Okay, you ready?
Yeah.
Ready as I'll ever be.
Ready as I'll ever be. And we're already recording.
Dun, 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 dun. Hello.
Hi.
Welcome to another episode of the
Nuanced
Naturopaths. Now in one video. Don't
Brand new format.
brand new format, but don't get used to it necessarily because this may not always be the case.
Yeah.
But when we're recording,
Depends what it looks like, and it took a long time to get it set up.
yeah.
So.
But so hopefully it's worth it. Let us know if you genuinely let us know if you prefer to see us like talking to each other like this. You see us in the one frame, or if you like the close-ups of our face.
Yeah, because
while we're facing the camera, but also trying to face each other.
Yeah, because the thing that the problem we had before was that we had the camera or my phone in the middle of us, and so we couldn't talk to each other and look at each other's eyes.
Right, so I was just like, Julie, just look at the camera but pretend you're looking at it.
Yeah, which I found really difficult to do. And also I felt like it got in the middle of our conversation. And it affected the flow.
Yeah. So I'm curious to see how this flows differently.
Yeah. Yeah.
What do we call today? Maybe it is simplifying the problem with simplifying the complex.
Yes.
And then in brackets, and the problem with complexifying the simple.
That's part two.
That's part two.
Yeah. An explanation of what that means?
Well, I think the whole podcast is going to be an explanation, right?
Yes,
So
that's true.
So do we just start?
Let's just start. Okay. So, as humans, and this is not a judgment thing. It's not a good or a bad thing. It's what we do.
It's just observational.
It's observational. I believe that we do this in order to understand the world around us, to be able to communicate, to be able to understand things that we maybe don't have the skills to understand.
Yeah.
To keep us safe, so that we feel safe.
Yes, yeah.
So many things are about keeping us safe.
Yeah, or giving us a perceived sense of safety.
Yeah.
Understanding what's going on in our body is one way that we can feel safe.
Yes.
Feeling like we're on top of it, feeling like we're in control, feeling like we know what's going on.
Yeah. And to be able to sort the answer, to get the truth. We could do a whole podcast on what is the truth. We'll do that. We'll do that in a maybe a science researchy.
Yeah.
What is the truth?
Yeah, shit, that would be interesting.
But so as humans, we try to always make really complex things and find simple answers for them.
Yep.
And this is a problem when it comes to health, because people are often working within their skill set and their knowledge. And so that may lead to simply Googling the answers and or not liking the answers that you hear from, say, your naturopath,
Yep.
for example.
Yep.
And I suppose it means that people are not getting the answers they need. They might be getting the answers they understand, but they're not getting the answers they need.
Yes, and when we were first discussing this, and I was thinking about like just that act of like Googling your health, getting answers, and different people go about it in different ways, I guess. So again, this is generalizing and observational, but I think by going down the path of like taking it on board for yourself and being like, oh no, I'm going to figure out what's going on in my body, and then Google spits out simple black and white answers, it's a way of avoiding getting lost in the weeds, because sometimes when you take that path of like, okay, I'm going to work with a practitioner, and maybe there's going to be layers of testing, and maybe there's going to be layers of like trial and error, trialing certain things for a period, and but pulling back the layers, right, to put up this complex picture together. And I think sometimes people want to avoid that because they see that as getting lost in the weeds. But I feel like the Googling path is like, an attempt to avoid that, but then that results in not necessarily the outcome that you want or the outcome that you desire.
Yeah.
It gives this maybe alleviation. It gives this maybe false sense of understanding, because if what we're talking about is simplifying really complex things that are happening in the body, complex conditions, symptoms, and we'll get into an example shortly. Sometimes it's the simple answers or the simple explanations that aren't covering the whole picture that won't lead to the most optimal or most ideal recommendations, and then a person might get stuck in the same loop of poor health. Yeah. Because they're like, and it's this thing of like, oh, I've looked it up, I can't understand what's going on, or I mean, and let's actually forget Googling for a second. It's TikTok. It's TikTok, it's YouTube, it's Instagram. I saw a person on TikTok talking about this, and they said that this causes this.
Yeah. Or they said that they had these symptoms, and so I went and bought this supplement.
Because they use that supplement, and that's what they recommended. Right.
Yeah.
Again, it seems simple, it seems like the answer, but we're still in this loop. So we're actually more lost in the weeds by doing the thing that seemingly is like, I don't want to go down the complex path. And okay.
Yeah.
So before we get into the specific example, we're going to talk about protocols.
Yeah, I think so.
Yeah.
I think so.
So it's not just people with conditions that look for simplifying complex things.
No.
It's naturopaths too.
Naturopaths too.
And health practitioners.
Well, because, and this is, what I'm trying to say without judgment is, except that there is some judgment for some protocols. Yeah. I do have some judgment for some protocols.
Oh, for sure, yeah.
But being a naturopath is not necessarily a great business model at times, because if we're doing our job well, our patients get well, and then we don't see them again. And so if you're doing a really good job, you have a really high turnover, and then you don't make any money to feed you and be able to keep doing it. And an answer to that is to make a protocol,
right,
which enables you to market it beautifully, and you can really target the person that you're trying to treat, and it really resonates with them. And they say, I have this condition, and they look like they've sorted out a simple protocol for me to follow that will just like cut through all of the noise, and I can just do that.
And this is it. And to go back to what you initially said about being a naturopath, it's not just that you want people to get well and you want the goal to be that they don't see you again. It's that you're treating everyone individually, which from a business running perspective isn't ideal in terms of
the amount of time you take outside the console.
Times and costs, right, because if you were seeing 20 people a week, say, and they all had the same thing, and you're like, oh yeah, I know how to treat that thing, boom, 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 boom.
Yeah.
Hence, a protocol seems like a good solution, right? Oh, if I just target this condition, this syndrome, this disease, plan a protocol around that, get to know what people really resonate with when it comes to having that condition or syndrome or set of symptoms.
Which is called pain points when you're talking about marketing.
And when you're learning about marketing, that's what they encourage you to do. Focus on the pain point, hone in the pain point. People will spend money when they believe you've got a solution. When they want to change something about themselves and they're like, this is the thing that's going to help me make that change.
Yeah.
And of course that can be good, and that can be well-intentioned, and it can be pure. And of course it can be manipulative as well. And I think protocol marketing overemphasizes the problem.
Yeah.
And even in the marketing, they might say, with my 12-week protocol, or, with my 3-step protocol. And I don't need to put on that voice, but I'm putting on the voice to show you that it's not me saying it.
Yeah.
There might be hinting at what the solution is, but it's usually not the solution they're offering that gets people across the line to pay money to sign up for something. It's usually the emphasis on the pain points and the way they communicate those pain points, right?
Yeah.
And at the end of the day, And so, yes, it's simplifying practice. It might be an easier way, an easeful way for practitioners to make more sustainable income. But as naturopaths,
that's not what we do.
we should be treating the person whole.
The whole person.
In front of us. We don't, and in fact, I've gone so far as to say, I don't treat conditions. I treat people.
Yeah.
And not even I treat people, I support people, I guide people.
Yeah.
With all the whole unique picture of what they're presenting with.
Yeah.
Not like, oh, you have, dare I say, SIBO, because we're going to get into that. Oh, you have small intestinal bacterial overgrowth, and that's what we're treating.
Yeah.
But people want that.
Well, that also means that we're talking about a diagnosis here.
Yeah.
And we don't. Oh, there's a lot of talk about do we diagnose, don't we diagnose?
Oh, no.
Aside from that, a diagnosis is just a name for a collection of symptoms. Now, that particular set of symptoms might come with a particular pathophysiology, so the way that those symptoms have developed.
Yeah.
But at the end of the day, any diagnosis is just a name for a set of symptoms. As naturopaths, the diagnosis isn't that important to us. What we want to do is go back and say, well, what started that? What is the root cause? What are the contributing factors that have helped along the way? Because two people might have SIBO, but have different contributing factors.
Yep.
And as a naturopath, we should be looking at those contributing factors, and we should be looking at the root cause.
Yep.
And it might be different for every person.
And dare I say, even if you are a treatment-focused practitioner and you do focus on, oh, well, no, I treat conditions, and maybe you treat two people's SIBO, and maybe they both feel better, but if you haven't addressed those contributing factors, will the SIBO not just return? If there are still factors at play, so you may alleviate some of the stress of the condition.
Yeah.
But it's not necessarily getting to the root of it. And like, I do want to say, because this is just, I can't reiterate enough how similar this is to the podcast I did about PCOS. And I'm so glad to hear you saying things like, and I think it is a point of contention, but when you say things like, as naturopaths, we don't diagnose, what's interesting is, technically as Australian naturopaths, I mean, we do all need disclaimers saying we are not medical professionals. We are not medically trained doctors. We do not treat, diagnose or cure any diseases. But I've also seen leading Australian naturopaths say, like, we need to forget this notion. We are absolutely meant to diagnose. That's how we treat.
Well, this is a difference in legal terminology.
Right.
Because legally we are not allowed to diagnose a condition. We can't write you a certificate and say you have been diagnosed with this.
Right.
But we do need to determine, if we want to use a different word, what it is that you are experiencing.
What's going on in the body. Yeah. And that doesn't have to be I guess the other trouble we can come up against sometimes is that sometimes people want the label.
Yeah.
Sometimes people want it to be black and white. No, what do I have? What is wrong with me?
Is that because they need to simplify it?
Probably. And sometimes I can even recall times where I've maybe suggested, like, yeah, it's looking like it's presenting similar to irritable bowel syndrome or polycystic ovarian syndrome, or yes, this does have the signs of endometriosis. And then I will hear that client say, yeah, my naturopath told me I have
this.
Yeah, like talking about me, and I'm like, oh,
I didn't diagnose it.
Right.
Yeah.
So
can I just say though, irritable bowel syndrome is a collection of symptoms which is considered to be an idiopathic. So we don't know what causes it.
Yeah.
So it's not really a diagnosis anyway.
Well, they call it a diagnosis of exclusion.
Yeah.
And that's why I felt so comfortable talking about polycystic ovarian syndrome on my my menses podcast.
Yeah.
No, I truly for over an hour I just ranted about the flaws of the diagnostic criteria and the flaws of even, needing that diagnosis, and also just the absolute incongruency I see in clients coming to me with experiences with gynos and doctors who are telling them all sorts of different things. And these are clients who might have the same symptoms, but the doctor told them two different things. Or I get two people with completely different presentations, but the doctor tells them the same thing. Or regardless of what the doctor says, the treatment is the same, and the treatment is the pill, and that's not addressing the root cause. So I ranted about that. So if you're interested in this conversation, zooming into polycystic ovarian syndrome, you'll probably get a kick out of I go on a lot of tangents. I get very angry. I swear a lot. It's actually, I surprise myself.
Definitely going to be listening to that.
Great. When we talk about syndromes, I feel a bit more confident criticizing the process of diagnosis.
Yeah.
Because you know what, and when I'm not interested in the diagnosis is when it's not really addressing causative factors.
Yeah.
And especially if the treatment based on having an official diagnosis doesn't address the causative factors. At that point, as a naturopath, I'm like, what are we doing here?
Yeah.
What is this for? Who is this for? The other thing I want to shout out is us. Two things I want to shout out. We did an episode, and I'll pull it up. We did an episode about attachment to health labels.
Yes.
Which is just a really good footnote here. And I'm going to pull it up now.
Yeah.
And while
you're doing that, what was I going to say? I've lost the thread now.
I had another podcast to recommend while I'm looking for our podcast. Saja Popham, The Plant Path. He's the founder of the School of Evolutionary Herbalism. His most recent episode of his podcast, called The Plant Path, was specifically about diagnosis, attachment to diagnosis, and like health trauma, and identifying, over-identifying with diagnoses.
Yeah.
And that being a bit of a barrier in working with clients who don't seem to get better. And sometimes it's because there is a deep attachment to the label they've been given.
Yeah. Which would then make you say, why is there an attachment? What happened to you that you need? And I said this with genuinely, without judgment. Why do you need that?
Yeah, it's serving a function, right? It's serving, whether it could be a protective layer, it just could be that layer of, oh, this is the thing that explains what's going on in my body, and it offers a sense of control. It offers a sense of, I understand, I've got it together, right? It'll be serving something on some level.
Yeah.
Our episode that we did on it is episode 11 of our podcast.
Oh, wow.
Attachment to health labels and diagnoses, the link to shame, guilt, and mental health mini-sode. How long does that episode go for, actually? 13 minutes. Oh, gee. We could talk about that for a long time, but I'm surprised it was just 13 minutes.
What was holding us back?
Yeah, shit.
I bet that was probably something we did at the end of a longer recording.
Yeah. Anyway, I just wanted to add those in there as the part of the book that says for further reading. Yeah. For further listening on this context, look at that. Look at those things.
So when we're talking about a SIBO protocol in particular.
Yes.
And this is something that Corinda is aware that I may have ranted about a lot, because I've had some very strong feelings about SIBO for a long time. And I am doing my master's, which is the world's longest master's, because I do a subject and then I don't do any for a few months and then I do another subject. And at the moment I'm doing integrative gastroenterology. And so we've been talking about SIBO. And my theory has been for a long time, why are we focusing on SIBO on its own when it is a sequelae from a deeper issue? Most times it's secondary to something else. So it's the main causal factors for SIBO. So to clarify, microbes in the small intestine in greater numbers than they should be, because usually in the small intestines there are very few microbes. Most of our microbes are in the colonic, so further down.
In the large intestine.
So why are they there? Why are we experiencing this? And most of the time, it's to do with the colonic bacteria being disrupted and affecting the motility, so how fast food travels through the gut.
Yep.
And so I was always like, why are there these SIBO protocols that are not addressing at least looking at the dysbiosis in the gut? A lot of them focus on kill, which is another thing that I don't believe is valid anymore. It was the old thinking about.
And we learnt it at uni. Dare I say, everyone we went to uni with would be familiar with the phrase weed, seed, feed.
Yeah. Well, let me tell you that is out the window.
Yep.
There is no weed, seed, feed anymore.
No.
It's a lot more convoluted than that.
Yes. And sorry, and keep going. Sorry, because I feel like keep flowing.
Yeah, that was that's so I just got a bit of a bee in my bonnet about SIBO protocols in particular, because I think that they're marketed very well. I think it and I'm sure, having said that there are some great naturopaths working with SIBO protocols who are actually just treating the person in front of them.
Yep.
But marketing as a protocol. But I would encourage anybody who's looking for answers for something like SIBO or PCOS to investigate the naturopath that you're working with rather than look at the shiny brochure. Because the best naturopath to work with is the one that you resonate with.
Yeah, more than anything else. Yeah.
B, who will put in the work to investigate all of you, because seldom does a person come to us with one thing. Even if they think it's only one thing. There is more going on. So you want the naturopath that's going to be able to treat whatever it is. Whether it's SIBO and colonic dysbiosis, which is caused by a food intolerance and a parasite and I don't know.
Well, there's a degree of IBS, and a lot of it is driven by anxiety, and that's changed the gut motility in the first place. And or chronic stress has suppressed stomach acid, and then that has a runoff effect.
Too many antibiotics because of some surgery that you've had, and maybe there's some adhesions or some strictures, some changes to the physical anatomy that's caused a slowing of gut motility.
And I think another way of looking at that in terms of looking for a practitioner is look for the practitioner that will work for you, not the practitioner that is going to try to get your case to fit into their protocol.
Yes.
If that makes sense.
Yeah.
And again, protocols can be good, especially if it's in a demographic of people who maybe aren't doing many healthful things for themselves. And if they actually stick to a naturopathic protocol that introduces diverse range of foods or lifestyle practices or any degree of herbal medicine or food as medicine.
Circadian signaling.
Circadian signaling and working on circadian rhythm. That could be a drastic change for that demographic of people, and that produces results. So it's not to say that protocols will never work, but when our interest is getting to the root cause, that's where we see protocols falling short. They can absolutely alleviate some things.
Oh, absolutely. But also, if you have, say you are aware that you have a diagnosis of SIBO or PCOS, and you go to see somebody for a protocol for that condition only, it might be that colonic dysbiosis is actually the greater problem that you have, or hormonal imbalances. or congestion in the liver that's, any one of these things that as a practitioner we would identify as actually more important to treat first.
Yes.
That's not to say that we wouldn't be treating those conditions at the same time. But, it's about being able to sort of adapt and change to what the patient in front of us needs.
Yeah, absolutely.
Yeah.
And sometimes it might not always make sense to the patient.
No.
And sometimes the thing that they want the most help with might just be the thing in their body that happens to be speaking the loudest.
Yeah.
But it doesn't mean it's the thing that's causing
the
symptoms that they're most uncomfortable with. And I think perhaps that's a good time to talk about how, in the example of any kind of digestive issue, I will always look at the different levels of digestion, because it's not just a small intestinal bacterial overgrowth. You don't just treat the small intestine. You look at what comes after the small intestine, well, the large intestine, and things travel through that ileocecal valve and the large intestine, and then into the rectum, and then the anus, and then before the small intestine, well, you've got the stomach, and then the liver and the gallbladder help out, and then the pancreas plays a role as well. And you sort of need to look at all levels to go, okay, at what level is something being hindered or disrupted? And maybe it's resulting in a change, it's resulting in a disruption in this part, but actually we need to address this earlier part first. And then actually it's affecting this part at the bottom as well, but that's just less obvious. But we still need to be addressing that in order to, support good health in the long run, or to prevent other symptoms popping up. So I think that's another good way of looking at it, is that sometimes having that really narrow lens. Again, in the moment, it seems like it's the right thing to do, to just be like really focusing on this one thing, and that's the client's priority. But usually it requires a broadening out that gives you the full picture, that offers the sustainable treatment options. It might be lower and slower. It might not be progress as quickly as one expects.
Because especially if a condition has developed over a long period of time, we've got to peel back the layers and work on it in that way. And it might mean that there's a really simple answer to that, like, are you chewing your food? Don't eat like a snake.
And
just swallow the whole meal and then just lie still and wait for it to digest.
Oh my God, that's a fantastic analogy, and such a good example of such a simple thing. How many patients have I said that to? How many patients have I written that in their treatment plan? And I've told them on the spot, I've said, it's going to sound annoying and you're not going to think it's making a difference. But if I say chew each bite of food 20 times and you actually try it, you are going to realise how seldom you chew your food 20 times.
Because most people have eaten like that their whole lives.
Right.
Because, not talking about anyone that we both know, that might have gone to school at a boarding school where you had to eat your food really fast or someone else took it off you. And so you learn to eat really fast.
Talk about eating in the nervous system and the bloody link there. How many people eat when they're like on their way to work or have high pressure jobs and they're like, I don't really have time for lunch, so I just need something that I can scoff down.
Scoff. Don't scoff.
No, don't scoff. But in saying that, I feel my clients' eyes rolling into the back of their head energetically while they're looking at me and saying, okay, I can try that. I can feel it, because it sounds so obvious, but also so simple and also so potentially disconnected from the problem they came to see you about. That it's like, is that even going to do anything?
Well, should we break it down? Should we explain why that simple
example?
That simple thing can make a difference. So by chewing your food slowly, well, first of all, let's start with the cephalic digestive. So the cephalic system is when you look at your food and you think about your food and you smell your food, your body starts to produce the digestive juices. It starts to get you in the mode for digestion.
You think about salivating when you smell something nice or when you see food that's appetizing. That salivating is happening at multiple levels of your digestion, but salivating is just the most obvious one, right?
Yeah. And that salivation, that saliva that we produce, contains enzymes, amylase in particular, particularly, but others as well, that will start to break down carbohydrates. And so we need the food to be broken up really well so that it can coat so there's less surface area for those enzymes to start breaking that process to start occurring.
More surface area?
More surface area.
Okay.
Sorry, did I say less?
Yes, yep. So we break it down into smaller pieces equals more surface area for enzymes to do their job. Yep.
Also, it allows more saliva to help the food to slide down and to break apart.
Yep.
So we want it broken apart to make it, easier. We want the stomach to be producing really healthy amounts of hydrochloric acid, which is needed for breaking down proteins.
B12 absorption. Iron absorption.
Iron absorption, calcium absorption.
Yep, those minerally type nutrients.
Magnesium.
Yep. To kill any potentially pathogenic bacteria that could be from the food or from our mouth.
From our
acid will kill bacteria. In most cases,
it's the first line of defense for the gut microbes.
Yep.
And if you don't have sufficient hydrochloric acid, it's one of the contributing factors for SIBO.
Yes, yep.
And there is actually a subset of SIBO which has predominantly oral microbiome bacteria.
In the small intestine?
In the small intestine.
Whoa.
It's rarer than the other form, which is more colonic, so coming up from below rather than going down from the top. But if you don't have sufficient hydrochloric acid because you're eating like a snake,
i.e. not
just
chewing
one
enough.
of the reasons, not chewing enough, you're going to be contributing to SIBO.
Yeah, at the least it increases the likelihood that something less potentially harmful is going to be able to get from your stomach to your small intestine, whereas in an ideal stomach environment, things that aren't meant to be going further are getting killed off at the stomach acid level.
Yeah.
And the other thing that flows into, and maybe this is where you were going to go next as well, is the more broken down food is before it reaches your small intestine and certainly your large intestine, but before it reaches the part of your digestion where there are other microbes at play, microbes that feed off undigested food particles, the more broken down food is before it hits that part, the less likely you're going to get excessive fermentation that causes uncomfortable gas and bloating and abdominal pain. And the less chance you are providing, and maybe I'm oversimplifying it now, so let me know, the less chance you're giving pathobionts and potentially pathogenic species to feed off of those things that then help them overgrow, that then contributes to something like SIBO.
Yeah, absolutely. Which will also give you more gas, and more gas is going to push up into the stomach. And pushing up into the stomach is then going to create more pressure on the lower esophageal sphincter.
And that's going to produce reflux.
And then what do you take for reflux?
PPIs. And what does PPI do?
It stops the production of hydrochloric acid.
And then what's that going to do?
Create nutritional deficiencies because you can't absorb your zinc and your magnesium and your calcium.
Yep.
You're not going to break down your food and you're going to have more bacteria in your stomach. And all of this comes back to what? Just chew your food more. Simple.
Got him. That is a great full circle example. That is a great full circle example of like, don't underestimate the small things that you can do every day. Chew your food.
Yeah. And we haven't even talked about the pancreatic enzymes and
Oh,
the
yeah,
other
we didn't even get to
gastric juices.
We
that
didn't
are,
get to the arse.
Yeah. Oh, yeah. Well, we didn't actually get into the duodenum or the jejunum at all because these other gastric secretions. There's a myriad of them that are also really important contributors to the way that food is broken down, to the way that food, to nutrients are absorbed, or extracted, or transported.
To signalling in terms of blood sugar regulation, in terms of hunger,
in terms of weight, what happens to the glucose when it gets into your body.
Yeah. Oh, yeah. Oh, shit, we could go. I just remembered cholecystokinin, CCK.
Yeah.
I just remembered that and I got excited because I just remember learning about it for the first time. I was like, oh, what an exciting molecule.
Yeah.
Anyway.
And bile acid secretion.
Bile acids. Oh, and how important they are for hormone health.
Yeah. And we want good, healthy bile secretion.
Yeah.
We don't want no sludge.
Yeah.
Or stones. Any of those sorts of things occurring because we didn't chew our food properly.
I know, truly. There's just so many simple solutions. So that's the pancreas releases bile stored in the gallbladder, released from the gallbladder.
Released from the gallbladder, unless you don't have a gallbladder.
The gallbladder, and then it's trickling out from that.
Yeah. So it trickles from the liver in via the common bile duct into the gallbladder.
Yeah.
And then it's
concentrated and stored in the gallbladder, waiting for a meal.
Yeah, we also recover bile. Bile is an expensive thing for the body to make, and so we recover bile and it goes back in and it gets more concentrated, and then it's released by the gallbladder. Does this.
Yeah. Spasm. For anyone who's just listening, it contracts.
Contracts. Yeah. Yes. On the signal of particularly fats coming into the digestive tract.
Yes. Yep.
But you got to give it time.
Yes. So again, another problem with eating like a snake and eating fast, right?
Yeah.
My mum's going to like this episode.
Do you think?
Yep. She eats fast. And if you're listening, Mum, come on. How many times do I have to die?
But it's so easy, I think, for us to say, just chew your food more, because this is one thing. Mm-hmm. This is only one thing of the simple things that we might need to talk to you about in a consult.
Yep.
And there might be 20 of these things. So to explain, to explode this out into this kind of explanation would take up.
Yeah.
How long have we been talking
I know,
about?
I know, exactly. And yes, our consults are longer than a lot of other health practitioners, but
they need to be.
But it still doesn't mean we have time to explain it in this level. But and it's also making me think of, like, if I did have to have a protocol, it would be made up of all these more universal, simple little things that stand on their own, people might scoff at or roll their eyes at. But if you turn it into a protocol, it's like, oh, wow, like the Bible of healthy living. Oh, wow.
Yeah.
And do you know the other one I would pick for digestion? Oh, guess actually, It pertains to the other end. I'll give you that hint.
Pertains to the other end.
Yeah.
So bowel movements.
Actually, now I'm trying to think if you even...
I don't know. I'm intrigued. Go on. You have to tell me.
A pooping stool.
Oh, yeah.
Imagine if... Because you see more digestive clients than I do, I think. Imagine if all of your clients... or just came to you already doing that. Imagine how different their presentation would be, or how easier it would be to just be like, okay, I already know they're in the correct anatomical position when pooping.
Yes.
And actually, no, not even if they're already doing it. Imagine if you just gave that one piece of advice at the end of every initial consult while you're working on the bulk of their treatment plan, and you said, okay, I'm going to work on your treatment plan, I'm going to come up with a beautiful individualized formula for you, but I want you to start doing this. I want you to start putting your feet up raised when you sit on the toilet so that your knees are above your hips. Could you imagine the difference alone that would make?
Yeah.
Especially to people with constipation or even IBS. I'm a more diarrhea person, and that helps.
I had forgotten about that because being mobile for the last 18 months, I don't have and I can't remember what it's called.
Like a Squatty Potty.
Squatty Potty.
Well, it's a brand. That's a brand name.
Yeah, and
that's why I said pooping stool.
Corinda will put the link to the Squatty Potty.
Sure can.
In the show notes, and please watch it because it's hilarious.
Oh, the ad.
Hilarious with the little rainbow unicorn.
Yeah.
Yes.
Cool. Just another example of something simple.
Yeah.
We've been laughed at. I remember joint consults we were in where we had to convince someone to just try it. Just turn your laundry basket upside down. You know that classic laundry basket. Just turn it upside down. Place your feet atop. And in Ayurvedic medicine, they even suggest a way that you should be facing in relation to the sun and how your head should be. Oh, it's a whole other thing. Yeah.
Well, you think about it. Traditionally, we didn't have toilets.
Yeah.
We evolved without toilets, and so, you know, you like go to any Southeast Asian country, and there are places where you have to squat because there is no toilet. Mm-hmm. You squat over a hole. But
that's how we...
Yeah, and it's very
That's how we
natural.
poop best. Yeah. Reduces risk of hemorrhoids, reduces risk of fissures, if I may say.
Prolapse, I mean, particularly if we're talking about perimenopausal or menopausal people.
Oh, gosh.
It's... prolapses are really common, and that constant straining of, you know, pooping can contribute to that.
Yep.
So... I had forgotten about the Squatty Potty.
There you go.
Got to get myself a Squatty Potty again.
And that's the other brilliance of these small tips is that they're easily forgettable. And so that it's just a breath of fresh air when you can remind a patient to like, hey, remember this thing we discussed 12 weeks ago? Oh, yeah, I did fall out of routine with that, but it did help. Yeah. It's just so easy to put back onto the radar. Oh, yeah, I can try that tonight. Done.
Yeah. Very true. So... I suppose to tie it up, I mean, we kind of did that. It's oversimplifying things, looking for the simple answers to what might be a complex issue isn't necessarily the right way to go. And sometimes you need somebody that has a health science degree to be able to tease out the truth or your truth. You know, for your health, what you need. Yep. Yes, there's lots of health information on the internet, but whether that applies to you is something that you actually need some help with. Yes, yeah. Discerning. Yeah. Yeah.
That's the thing I think everyone could do some support with. So to further tie it up, we started with simplifying the complex and the problem with that can leave us with answers that seem good on the outside, but the results of which maybe don't really help us in the long run. And then on the other side, we spoke about how often the most universally beneficial answers and recommendations are ones that seem more simple than what our patients would expect or like. And I think that's because it's when you are the person experiencing the symptoms and it's so uncomfortable and it's all encompassing and that's all, you know, you've had such this narrow lens on this problem thing, and we present a simple tip and with our knowledge, we understand why it would work, but to them it's just like, no, that seems, that's... No. It's either too simple that they won't even bother trying because they go, no, how could that possibly make a difference to my intense experience, right? Or they seem like their symptoms are too severe and maybe that would work for someone else, but no, I need something more drastic. And so that's where I want to let's balance out the complex and the simple in both contexts, in the times where we want to simplify the complex things because that's in our nature, and in the other times where we're presented with a simple answer and it's just a gentle little slap in the face that we need, but we're like, no, there should be something more. Yeah. And sometimes the lesson is try the simple thing.
Just
Does
try it.
Does it have to be hard? Does it actually have to be harder than you expect?
Yeah. Yeah.
You know?
Yeah, and I would just like to differentiate, because I sell programs and you sell programs.
Yeah.
But programs are different from protocols.
I was thinking that actually, yeah.
So a program, it might be that you come to us for a certain number of visits or a certain period of time.
Yeah.
And that enables us to really fully lock into what it is that we're treating, and to be able to stage that out appropriately for you, much in the same way as you would for a protocol, but this is specific to you and you only.
Yeah.
Without, you know, you are committing to a period of time, or a certain number of appointments. We have the ability to then stretch that out in that way. Otherwise, people sometimes come to us for a single appointment and they're kind of like, I'm not sure that I trust you yet. Well, then maybe not overtly like that, but I'm not sure that I feel confident enough in this process to invest in a program. And so I'll see how we go. Yeah. We might not expect to see symptom change. Yeah, after
that just
quickly,
one visit.
After one visit. It's you know, this isn't a magic pill. This is undoing layers of what's occurred over many years, perhaps.
Peeling back the layers, teasing apart what's actually going on, and then applying appropriate treatments. And that's and that takes time. And I think one of the other reasons I prefer to work in packages is because it sets up the expectation that this isn't an overnight fix. Yeah. This isn't a magic pill kind of fix. This is a journey, and you got to show up for yourself. And I find a lot of especially more my recent clients, they love the accountability of having a check-in every couple of weeks. Yeah. Whether they've done the things I recommended or whether they have not done the things I recommended. Yeah. They like the process of checking in and me keeping them accountable. And there's always more to discuss. There's always another body system to look at. There's always a little symptom popping up, or a little aspect of family history that pops up, or a question they have. Something
that's come up that's actually stopped them from participating in the treatment. And that's important too, because we're always meeting you where you're at. Yes. And so it might be that you come to me and say, I haven't done any of the things that I said I was going to do because X, Y, and Z came up. So then we might actually change direction and say, okay, well, if this is coming up, maybe there's an easier way for you to do it. Yeah. Yep. So we might rejig the whole thing. So that we welcome the obstacles, because usually they give us answers as well, and we can workshop them together. Because that's part of you. Yeah, absolutely. I'm interested in it. If it's something that affected you, or that crossed your mind, or that, you know, whether it was positive or negative in your experience, like, let's work with it. Bring it to the table. We'll work with it. And so I'm glad you mentioned that, because I was thinking that before. Like, I offer 3 or 6 month packages that are called harmonized hormones, but people don't come to see me and then I give them their PCOS mix, and then I give them my proprietary herbal formula for endometriosis, or for menopause, or for fertility. Like, it doesn't. Yes, it's a journey, but the journey is going to look different for everyone. Yeah. And I do think, I have thought about running group programs to make it more affordable where people have the same sort of symptom picture. But it would only ever be based on the same foundational principles that I find myself being applicable to most of my clients. Yeah. It would be those basic little universal steps, like chew your food, that we know most people aren't doing, but we know most people would get benefit from. Yeah. Rather than, you've got PCOS. Yes, this is the specific herbal prescription that works for PCOS. Yeah. Herbs don't even work in that way. Herbs don't recognize diseases. Are you kidding me? No. They work with, like, your cells and your tissues and receptors and your microbiome and each other. Yeah. So that a great way to wrap up to promo us. If this is the kind of nuanced
what I would call a no stone left unturned approach.
Oh, yeah. I like that.
And Julie, let me tell you, let me shout out Julie. Julie is the practitioner. I will divert clients to Julie. If people meet both of us and they'll start going on about, you know, their really complex health story, I'll be like, Julie's the practitioner for you, because I know she can work with a syndrome that she's never even heard of, and she will do the research. She will be thinking about you between consults. She'll be coming up with new ideas between consults, and she will get to the bottom of it.
She'll be thinking about you years after.
Years after. Genuinely. So if you're interested in that kind of approach, you can use the links below to connect with either of us. There's also a link to a form where you can contact the nuanced naturopaths, and so you can contact both of us if we're happy to offer that if people would like to work with two naturopaths at once.
Yeah.
We're excited for that.
Particularly if you've got some reproductive hormone
happenings,
menstrual issues happening.
Yep.
And maybe some other complex health thing going on.
Yep,
Digestive
SIBO
health.
and endometriosis, or IBS and adenomyosis, or IBS and PCOS is a common. SIBO and endo is a common one. And
maybe we could do some of the group things and individual consults in and together. If contact us.
If they wanna, let us know if you like that. And you can also reach out to us to let us know any episode requests. If you have anything that you'd like to hear us yap about, we love responding. We love reading a prompt and going, oh yes, we could talk about that. So send us your episode requests. You can follow us on Instagram. Wherever you're listening, if you're not subscribed but you like what you heard, please subscribe or follow us. Spotify, Apple, YouTube. And certainly if you liked what you heard, consider leaving us either a like if it's on YouTube or a rating on Apple or Spotify, because it just helps our podcast get around and reach more people who can benefit from the crap we have to say.
The really good, valuable information that we have to share.
Yes, absolutely. The underrated small tips, like chew your food and use a Squatty Potty. That not enough people are shouting from the rooftops. Yeah. Until next time, stay nuanced. Okay, great.